Good day everyone, especially to you Sir Villa. So in this video, we'll be tackling about the one of the family planning method which is cervical cap. So I am Engine Cadet Omania
I
and
am Engine Cadet Pradilia.
we'll begin our talking about cervical cap. Next slide please.
All right, so let's start with how the method works. So this small device or the cervical cup is a small device or a dome-shaped device made of silicone or a rubber that is inserted into the vagina to cover the cervix. So it acts as a physical barrier to block the sperm from entering the uterus. So for better protection, it is usually used with spermicide, which helps kill or slow down the sperm entering the vagina. So the cup must be inserted before sexual intercourse and kept in a place for 6 to 8 hours afterwards and after use. So this device, you can also reuse this after clean. So the next would be the advantage and disadvantage.
Okay, so let's talk about the advantages and the disadvantages of cervical cap. So first, on the advantages, we have hormone free. So what does it mean? So the cervical cap does not contain hormones that can affect the menstrual cycle of the woman or the mood changes of their during their menstrual cycle. So next advantage is it is reusable and long lasting. So cervical cap can last 1 to 2 years depending on how you use it for storing and also for the cleaning. So third advantage is can be inserted before intercourse. So this cervical cap can be gives less stress during sexual intercourse because the women can easily insert it before or during or having sex. So last advantage is the user controlled method. So the women can only can implant already this cervical cap depending on which she or how she will conduct this kind of protection. So the male will not be able to control the cervical cap because cervical cap is only good for women. So the disadvantages is first less effective after vaginal childbirth. So after having pregnancy or having a childbirth, the cervix will be reshaped. So the cervical cap is not more into the actual size because of the reshaping of the cervix. So second disadvantages, it needs proper fitting by healthcare providers. So a doctor or a nurse could be a healthcare provider. Thus, this kind of service is having a cost. So it will be costly. So third disadvantage is can be uncomfortable or difficult to use. So cervical cap is very much more concerning about its comfortability because cervical cap is unusual in cervix, and if it is not properly inserted, then the rate of the pregnancy will be higher. So last disadvantage is lower effectiveness than some other methods. So this kind of family planning method is high risk, high reward. So whenever it used in inefficient and ineffective, then the pregnancy will rise and the effectiveness will be becomes lower. So next slide please.
So as for the effectiveness, the cost, and the availability of this device, the cervical cup. So this device is moderately effective with about 86% of effectiveness for women who have never given birth and 71% for those who have. So this given data or percentage is based on the American Pregnancy Association. So they also said that the cost can range depending on the clinic and brand. And additional spermicide is also needed. So the availability of this device is very limited as it is usually required a prescription and fitting by the healthcare provider. So it and may not be stocked in all pharmacies or clinics, especially here in the Philippines. So next would be the personal insight.
So, after we discuss about cervical cap, for us, the cervical cap can be a good choice for individuals who prefer a non-hormonal reusable family planning method, and um, for the couple who wants more control over their reproductive health. However, it has also a catch. So it has a higher difficulty in on its application. So it requires proper fitting, proper usage, and also it has an issue with its comfort while insertion. So it may not be ideal for everyone. So choosing this kind of method means being a responsible couple or being informed to ensure it is used safely and effectively. So remember, plan with care, be aware, protection you can wrap, the cervical cap. Thank you, and once
Sure.
again, a good day.
All right. Thank you.